Okay, so scars and adhesions. Why do scars migrate? I'm going to annotate on this. So you've got, say you were cut here, right? So that's a scar. You got cut in surgery. Okay, so your collagen, the proteins that make you, they have a half-life, right, of about a year. Different parts of your body has a different length of half-life. We'll just call it a year, right? If it's your meniscus, it takes a lot longer, right? But at about a year, your collagen has broke down and come back. So after 1 year, this much collagen has broke down and is replaced. In 2 years, this old collagen is broke down and replaced. In 3 years, this collagen is broke down and replaced. And theoretically, in 7 years, you've got a whole new body. But what's the system that's replacing this? And so what you've got are these little cells are called fibroblasts, and those fibroblasts are always moving around, laying down new collagen because collagen is always breaking down. And so now you've got a scar, right? And you've been cut. And so how does that scar heal? It heals through cross-fibering. And that is a beautiful thing. That's what you want. But these cells, these fibroblasts that lay down new collagen, they follow lines of force. And so how do they know what direction to go? They're following electromagnetic fields because your body is piezoelectric, it's electric. And so when you move, you're putting pressure on those crystals in your body and it creates an electromagnetic field. And so that tells the fibroblasts what direction to go. Now, a scar doesn't have movement. And so they don't know what direction to go. That's why it cross fibers. And so that really works. But now you don't have movement here because you have a scar. So now you have limited movement around the scar. Say it's an abdominal scar. Now your collagen is going to break down and renew, and these fibroblasts are going to lay down new collagen. If there's no movement there, what happens? They don't go in a direction, they cross fiber. And so now you've got a bigger scar. Just like that. And then over, say, 10 years, you've got a scar that may be an abdominal scar that actually migrated into your hip joint. And we see that all the time. I had a patient who thought she needed a hip replacement. Her C-section scar had migrated into her hip joint. And so we were able to remove this from the hip. It centered the hip. It released the femoral nerve that was like, it was really encapsulated. And she's done. She didn't need a hip replacement at all. Now, she's got arthritis in that hip, but she doesn't have pain, right? So if you don't have pain, you can cancel the hip replacement, okay? So that's why scars migrate. Let me get out of this. And then, so this is scars and adhesions. And so connective tissue connects. If you don't have movement, what's going to happen? Those fibroblasts are going to migrate and hop over, and they're going to connect something to something else, and maybe you don't want those connected. And here's a lung that's connected itself to the parietal pleura. The lung actually attached itself to it. Now we find that people who think they popped a rib, and then we thought, I pushed the guy's ribs in and it didn't work, nothing worked. And then it's like, well, maybe it's a nerve. And so we work on the nerve and that didn't work. We found out actually it's a lung adhesion. And then we study group this out, and we've got I'm pretty happy with, because I have a lung adhesion myself. When we practice on me, we were able to release this enough where it doesn't affect my athleticism and I don't have pain. It does come back, but it's very easy to treat it again now that I know that that's what my problem is. And it was the same with this other fellow. So that's a lung adhesion. Open heart surgery puts a lot of air and exposes the lungs. Bill Headley, the anatomist that took this picture, I have permission to actually use this. The anatomist that took this picture said 100% of his open heart surgery had lung adhesions, right? And if we don't get those moving, what happens is this is stuck. Now you're going to find that it's right next to it because of lack of movement. That'll stick, and then that'll stick, and that'll stick. So it's really important to get this treated. And plus the scar of an open heart surgery, right, is important to work sooner than later, right? As soon as you're exercising, let's get after that scar. Okay, so Gil Headley, he has great stuff. If you're a manual therapist, or an exercise or PT, you should really be watching what this guy's doing. He's taking the body apart in a way that we really care about. And so instead of just looking at the parts, he's looking at what's between the parts. And that's what we're working on as manual therapists, is what's between the parts. Okay, this is a healthy uterus. And so you see the uterus is floating here. That's your fallopian tube. That's your ovary right there. You've got the bladder sits right next to the uterus. There's your pelvic floor here. Okay. And then so this is a uterus with adhesions. This is post-op. Now they're not all this bad, but this is a pretty bad picture, right? And I felt, you can feel this stuff, right? And so the uterus is adhesed here to the abdominal wall here. Here's the bowel. That's your intestines. It's adhesed to the intestines. And so that's going to be painful. If this person eats a big meal, they may have actually restriction of the bowel from this. Here's the ovaries down here. They're completely glued to the abdominal wall through adhesions and the fallopian tube. And there's a lack of movement here. Now, this person is going to have very hard menstrual cycles. They're not going to be able to stabilize their core. They're not going to have pelvic floor function because you need this moving to have this functional. And so we may not be able to break all this up, but we can break it up enough through these techniques that we use where you're in charge, actually. We're not just in here pushing on this stuff. That doesn't work. It's very unsatisfying. We're creating movement. We're holding the scars while you make very specific movements. So you're totally in charge. We've done it on all of our people here who have scars. That's how we developed it. We've never had a person with a negative outcome. It's always been good, and the effects are always immediate. This is the best thing that we've come across, especially for low back pain. This person is going to have low back pain. This is a low back pain waiting to happen at L5-S1. And hard menstrual cycles, urination problems, the sacral nerves are right. I mean, they're right there, half an inch, quarter an inch away from this adhesions. One of those adhesions grabs the sacral nerve, you're going to be in a world of pain.